Hello, my name is Dr. Kim Kavanaugh. I am the Program Director and Department Chairperson for the Physician Assistant Program at Gannon University, and I'm going to chat a little bit about the physician assistant profession. I want to make sure that you know that at any time, please feel free to reach out to me if you have questions. My email is Kavanaugh, that's Cavanagh 002 at gannon.edu. So, what are physician assistants? So, PAs are medical providers. We are nationally certified and state licensed. That means that we take a national examination following the completion of a accredited physician assistant program. So that's a big test we have to take when we graduate from a PA program. And then we are state licensed. So every state has their own specific rules and regulations and practice guidelines or practice laws that we have to follow. So we make sure that our graduates know that they need to investigate and research the practice laws that exist in whatever state they're hoping to practice in. Being nationally certified, we have to maintain our certification. This takes place through continuing education as well as through recertification, examination, or assessment process. As PAs, we work as a member of the healthcare team. So this means that we work with several different other healthcare professionals. This can include nurses and physicians, occupational therapists, physical therapists, social workers, dietitians, and other healthcare providers. We work together as a team to provide the best possible care for our patients. So the PA profession started in the mid-1960s, so we are a relatively young profession, 50 plus years old. And it was started by a physician by the name of Dr. Eugene Stead at Duke University. At that time, there was an identified shortage of primary care physicians, and Dr. Stead started the first PA program at Duke, and that first class graduated on October 6, 1967. We celebrate National PA Day on October 6th, and that's part of Physician Assistant Week. The early PAs, many of them were Navy corpsmen. These were individuals who had really significant skill set and could go through an accelerated curriculum to enter into the healthcare field. They utilized a curriculum that was modeled by a curriculum utilized to fast track physician assistant training. The American Medical Association first recognized the PA profession in 1971. What can a physician assistant do? So PAs can deliver patient care in any setting in which a physician works. As I mentioned previously, each individual state has laws which dictate what individuals can and cannot do. We call that scope of practice. But a lot of what PAs do are what you are familiar with, what physicians do. So in general, PAs are qualified to obtain patient histories and perform physical examinations. So history is that question component when you go to see a healthcare provider. So for example, if you have a sore throat and your healthcare provider may ask you how long you've had it. Have you had a fever? Do you have a stuffy nose? Are you coughing? That's the history piece. We can order and interpret diagnostic laboratory tests. This could be x-rays, blood work, and other testing. We prepare and arrive at a diagnosis and implement a treatment plan. So treatment plans can include prescription of certain medications, patient education, patient counseling, referrals for things like physical therapy or occupational therapy. PAs can perform certain surgical procedures and assist in the operating room, and PAs can perform emergency care. PAs work really everywhere. So You will find PAs in almost every healthcare setting. This may be office or clinic based, it might be hospital based. We see PAs in essentially every specialty in medicine. So, this can include things like orthopedics or cardiology, family medicine, pediatrics, women's health, general surgery. So really, PAs are going to be found in all aspects of the healthcare field. So some examples of PA's roles and responsibilities. So we've talked about, the history taking and physical examination. So PAs will evaluate patients that could be in the emergency department. The emergency department is a common practice location for physician assistants. In that setting, they would evaluate patients. They may perform certain procedures such as suturing, casting, and we also see PAs with managerial and supervisory roles. So sometimes PAs are involved in healthcare administration. We see PAs in education, which is where I currently work. My practice background is cardiology. In that specialty, I saw patients in an office setting as well as in the hospital. I saw patients in the emergency room and had the opportunity to really interact with patients with a variety of cardiac disorders and complaints. Just some general facts about the profession. There are more than 130,000 PAs nationwide. In 2018, so this is a couple years ago, the median salary was 105,000. Just remember that this number is going to change a little bit for new graduates compared to individuals that have a lot of experience. So this is the median. In addition, salaries can vary based upon geographic location. The top specialty areas where you will find PAs include family medicine, surgical subspecialties. So, an example of a surgical subspecialty would be orthopedics, emergency medicine, and then internal medicine subspecialties. Examples of internal medicine subspecialties would be areas such as cardiology or pulmonology. The primary employers for PAs are outpatient offices and clinics and hospitals. So how can one become a PA? So there are a few different pathways. The most common pathway is that third one on the list, post-baccalaureate and graduate programs. So these are master's programs. So individuals go and complete an undergraduate bachelor's degree, and that could really be in anything. Most common bachelor's degrees include biology, chemistry, health science, public health, psychology. During the completion of those degrees, individuals need to complete certain prerequisites to apply to graduate PA programs. Master's level PA programs are usually 2 to 3 years in length. Will include what we call a didactic phase, which is in classroom education, and then a clinical phase, which is hands-on clinical rotation experiences. Other pathways to becoming a PA include things like an entry-level 5-year master's program. These types of programs are where students are enter a program as an incoming college freshman and progress through 5 years, completing with a master's. And so the PA education is kind of embedded in that program. There are also some undergraduate 3+2 or 4+2 programs, and this involves 3 or 4 years of undergraduate education and then 2 years of graduate PA education. This might be at the same institution, or it might be at a school where the school you're attending for your undergraduate degree has an articulation agreement with another university that you complete the final 2 years at. So there are a lot of options. The 5-year and the undergraduate 3+2 or 4+2 programs are certainly great options for individuals such as yourself who are in high school. And if this is what you absolutely know to be your pathway, that you want to, this is your career, this is what you want to do, then those are great options. A lot of people don't know what they want to do until they're partway through college. And so these post-baccalaureate or graduate programs tend to be the most common pathways. So I always tell students, you don't have to make this decision right now. If you know it, that's amazing, and you can explore schools that can allow you to pursue that career sooner rather than later. But I never want anyone to feel pressured to make that career decision, and so know that there's always this graduate pathway. Well, in PA school, students are going to take more than 400 hours of basic science curriculum. This includes biology and chemistry. Take 175 hours of behavioral science curriculum. This might include psychology and sociology. More than 75 hours of pharmacology. So pharmacology is where you're going to learn all about medications. Complete approximately 580 hours of clinical medicine instruction. This is where you're going to learn all different disease processes, and then complete about 2,000 hours of clinical rotation experiences. So what should you be thinking about now? So certainly sciences are important. So I mentioned you're going to take a lot of basic sciences. That science provides a really critical foundation for the information that you learn while you're in PA school. Disease processes are rooted in pathophysiology, and so you have to understand anatomy and physiology really well. And so I encourage students in high school, I know you're required to take biology and chemistry. If you have an opportunity to take other sciences such as anatomy and physiology, or an AP biology, I think that really is helpful. It gives you, again, good background as you go into an undergraduate science curriculum, and provide that foundational knowledge. It also helps you to know if you like sciences. You're going to spend a lot of time taking science courses, so it's helpful if you like it. I also think it's so important to shadow physician assistants. However, I think it's important to recognize right now, as we are in the setting of a pandemic, shadowing is really hard, if not impossible. So options that I think are also beneficial right now would be just to have a conversation with a PA via Zoom or FaceTime, or even over the phone, to talk with them about what they do day to day. Talk with them about what they like about their job, what they might not like about their job, what was their pathway, how did they get there. And I think that can provide a tremendous amount of information. And I also think it's really helpful to talk with more than one individual. Certainly, once it becomes an opportunity and a safe place to begin to shadow again, taking advantage of those opportunities, even while you're in college, that doesn't have to be done right now, can be helpful. Similarly, volunteering and gaining some healthcare experience. Again, these experiences are difficult right now because of the pandemic, but certainly when the opportunity presents itself, gaining some experience, familiarizing yourself with healthcare settings, having some opportunities to work on communication skills. It's so important. So much of what we do as PAs is talk, communicate with our patients, listen. We need to be active listeners. And so volunteer experiences and healthcare experiences of interacting with patients, interacting with residents in extended care facilities or long-term care facilities are really great beneficial experiences. So again, while these opportunities are not necessarily available right now, these are things to put on the list for the next few years, as you continue to kind of confirm that this is your pathway and prepare to progress into graduate PA education. So this, again, A very brief overview of the profession, but hopefully help to answer some of your questions. These are some associations and organizations that you might also find helpful in answering your questions. So the American Academy of Physician Assistants, this is our national practice organization. They have a tremendous amount of information about the profession, including some information for individuals who are just thinking about the profession, so kind of pre-PA individuals. The Pennsylvania Society of Physician Assistants is our state practice association. Again, a lot of helpful information. Physician Assistant Education Association is the National Association for Physician Assistant Programs. So through this association, you can find a listing of all of the PA programs in the country linked to their websites. They also have some really valuable information for individuals considering the profession. And the National Commission for the Certification of Physician Assistants, this is our certifying body. So if you remember, I said we have to be certified. So these are the individuals that make sure that we meet all of the requirements for certification as a PA. They also have some really great information about the profession, including statistics such as demographics within the profession, salary information, etc. I wish you all the best of luck as you continue your high school journey and, kind of make some decisions about what your career pathway is going to be. Again, please feel free to reach out to me if I can assist you with any questions. Again, that's Kavanaugh002@gannon.edu. I wish you all of the best. I hope you all stay healthy and safe and well.